My name is Christy Beatty. I'm an employee with the Williamson County UT Extension Office. I'm also a 4-H agent, which I'm over a couple 4-H clubs in our county. I started this project about a year ago, and then the pandemic hit. My idea initially was to do this in person so we could all be together and learn about mental health and how to parent that. But with the pandemic and everything, it kind of changed my plans, and hopefully this works out better. So when you're watching this at home, you don't feel like you're put on the spot to have to answer any questions. And my hope is that it helps you in some way, shape, or form, at least educate you in some way. So today I'm here with Grace Eakin. And if you want to go ahead and tell where you work and what your position is and what your group does.
Yeah, my name's Grace, as she said. I work for the Tennessee Suicide Prevention Network. I'm the Mid-Cumberland Regional Director. We focus on prevention efforts through intervention, prevention, and postvention to hopefully lower the rates of suicide in our state. There are 9 of me essentially across the state, all the way from Shelby County to Johnson City. So thank you for having me tonight.
Yeah. So how long have you been around, TSPN?
So TSPN has been around for more than 20 years now, but it's actually very interesting because we just got a grant last year to bring on the new staff. And so there were about 9 or 10 of us, I believe, at the time. And so we are the new wave that started last year, August.
And what is your job duties?
Oh gosh. Well, we have a lot of different duties, to be honest. We do a lot of trainings, a lot of educational trainings. We think that that's really the best way to get information out, correct information out to the people in Tennessee about how our state's doing, what we can do better. We also do we teach, I guess, forms of intervention. So, for instance, our most popular training is QPR. So that stands for question, persuade, and refer. And really that's teaching the people of our community how to talk to somebody who may be struggling right now. So that's been, honestly, it's been wonderful to do those virtually because we've just reached a lot more people than I think we would have otherwise. So that's been fantastic.
What led you to do this job?
Oh, I've always felt very strongly that mental health is just like physical health. You don't feel good upstairs, up here. It's going to affect your day. It's going to affect your week, your year. And I think it just needs to be taken just as seriously as physical health. And I also think that there's just a lot of people that struggle in silence, and I never, ever want anybody to feel alone. And that is one wonderful thing about every single person on our staff. I can say full-heartedly that we're all that way. We definitely want to make people feel in the communities like they've at least got one person to turn to, even if they're feeling as isolated as they're probably feeling these days.
So looking at the 2019 suicide statistics, as of now, suicide in Tennessee has been on the rise for quite some time. It is also the second leading cause of death with the youth. Why do you think that is? Well,
with youth, I think that the world around us is growing. And we're still the same people. So there's a lot of exposure, there's a lot of coping skills that sometimes don't get learned. Sometimes it has nothing to do with that, really. I mean, I'm just kind of speaking just kind of as a trajectory. But, I think that the stigma also keeps people from reaching out for help. Once you're sometimes come forward about how you're feeling, sometimes it's difficult to shake that stigma, shake that reputation sometimes. And so I think that keeps people from reaching out, and I definitely think it keeps the youth from reaching out.
How big of an impact has the coronavirus pandemic been in your line of work?
Yeah, so I'll be honest, the thing is that we don't actually have the 2020 data set yet for our state-specific figures. And so it's difficult for us to watch headlines that say suicide's on the rise. We can kind of say that as a correlation, but really, if without those numbers, it's hard to support something unless I'm looking at black and white what it is and what it's not. We do know, I will say, to put a positive spin on it though, we do know that a lot of people are reaching out to our crisis call lines. The national one and our statewide one, which is 855 Crisis 1. Lots of people are reaching out to them. So I guess just thinking positively about it, I guess I would say I'm happy people know where to go.
So obviously, as I stated earlier, this series is to educate parents. So in teaching them about mental health and suicide awareness, what is some advice you would give to a parent who otherwise doesn't know?
Yeah, well, I would say, first of all, it's okay not to know what to do. It's okay for them not to be okay too, for your children not to be okay. It's okay for you to struggle with the conversation. But I would just say you've just got to talk to people, whether it's your kids, whether it's your neighbor. I was actually thinking about this yesterday gosh, I have all this free time on my hands. What do I do with it? And what I've started doing is just picking up the phone and calling people and hoping their day is going well. And I think that that's just one of those things that hopefully we can do, just check in with our kids, check in with our happy kids too. When we notice behavior changes, when we just feel in our gut that something isn't right, know that it's okay to not know exactly what to do, but at least you're asking the right questions.
So if, let's start with one scenario, and that's when a child comes home, a preteen or teen comes home and tells the parent that they're worried about a friend. What's some advice that a parent should give that's helpful?
Well, I think that the first thing to do really is to have that kid question the other kid about their suicidal ideations, whether they're just feeling down, whether it's, transgressed to something a little bit more heightened as far as a crisis level goes. Just kind of assess, feel what your gut's telling you. A lot of times that's really the best kind of gauge. But then also to have the resources to help that person. And ask them if they're willing to get help. I think that that's another thing that's really a missing link sometimes with mental health is, okay, so we're getting better about talking about it, right? Well, now what do we do? Now that you've said yes, you may be thinking about suicide or, yeah, you've really been struggling. Well, then how do I help? And so I think knowing those resources, knowing in your specific area where to go, is really the best thing you can do. That way you don't have to look it up retroactively. You can know it on the fly.
Yeah. Is there any advice you'd give to the child that how they could treat their friend who's struggling? Like what's some ways a peer-to-peer could be helpful?
Yeah, I will say peer-to-peer, and really I would say this for any age, just try to listen. We may not be here to fix all the problems, but if we can listen, understand, and be there for somebody, I think that goes a lot further than we think it would. And just to be supportive, and like I said, the best thing they could really do too is just to have the resources, to know what's in their neighborhood, to know where to turn, and then to have another safe person at that school, in their sports club, whatever it would be, who's also aware of the situation, maybe an adult. I think that's also very important to not have just a confidentiality statement between the two. Yeah.
Okay, so if a parent realizes their child is struggling, is unsure what that actually means. I know from my personal experience, I knew my daughter was having problems in school, but I was not clear on the extent of what that was. So if someone in that position who just knows that there's been a change, is there some key questions you can ask your kid that would give them some insight into what's happening?
Yeah, and you mean kind of asking your kid if they're okay?
Yeah.
Right, okay. There's really two ways to do it. Well, there's probably a lot of different ways, but there's two ways that I like to think of it. You can, if you have the sort of relationship that you think can handle this. And also, if you think you're going to get an accurate response from your child, just flat out asking them, are you suicidal? Are you thinking about killing yourself? Just kind of getting it out there in the open. I will say, though, I know how I was, and I didn't like talking about things when I was younger. So there's also a less direct approach. And I think that that's really a great way to communicate. Start small. Start with something like, how are you feeling? Or how's your week been? Just kind of slowly open that door. One way and I know that usually it's said that for kids, this is a great way to ask, but I think it's great for everybody. That's a way less direct way to put it is, do you ever wish you could go to sleep and never wake up? I know that one's been, and then, make sure they understand, because I know we've all had weeks where we think, well, yeah, actually I'm really exhausted, but make sure they understand what you're getting at, make sure they understand what you're asking, because everybody can talk about sleep, right? But we can't all talk about suicide.
Mm-hmm. So as you mentioned, teens can be difficult to talk to. Is there a better time or place when we should approach those conversations?
Absolutely. I always think about, we were going through a training, our staff was, and one of the examples of approaching somebody in a not so great way was the teacher noticed something was wrong with the student and asked during a class change. So when I think about the best way to do that, I think about the opposite of that, I guess. So private, allow them to have plenty of time, and yourself. It's difficult to ask somebody about suicide, and it's even more difficult for somebody else to talk about their ideations. And recognizing that you're both going to have a little bit of grace with each other. You might have to struggle through a few parts of the conversation that aren't fun. Making sure that your body language is open. You're using your inside voice. You're making eye contact. And I know that those are little things, but they really do go a long way.
Okay, so you've taken these steps. You realize, yes, my child is suicidal. So what are the next steps that they can take?
So there are a few different steps you can take next. One thing that I always think is a fantastic resource we have in the state is our crisis line, the 855 crisis one. I say that because they're state specific. They can also tell you based off your location where the closest place you could physically go to. And they also can send out something called mobile crisis. This was a service I had no idea about before I worked in mental health. They can actually send out someone to do a free mental health evaluation. Oh, wow. Yeah, I had no idea because you just
I
don't know.
I didn't know that either.
Yeah, and so that's a great tool, especially when we may be talking to somebody, youth or not youth, that really needs a professional referral. Maybe they don't want to listen to us, and that's fine. That's when we call in mobile crisis.
So they'll come and assess the child, and then will they help connect you with a...
Yes.
Okay.
They give you a direct referral.
Okay.
And so honestly, too, mobile crisis is all around the state. I will say Google is a wonderful thing. If you type in, mobile crisis, if you type in mental health near me, things will pop up. Mm-hmm. And so I really do think, I really believe in the power of Google nowadays.
What are some ways, so if it continues on and maybe it's not a dire situation yet, but obviously it's there, what are some ways parents, and maybe peers too, can support that person?
Well, I think just checking up on people. I always say at the end of my trainings, I almost wish that the training was called QPRF for follow-up. Yeah. We're so good about that with people we don't even know, right? Whenever we finish an interview for a job, the first thing you do is either write the email that says thank you for your time or send a letter. And it's like we forget to do that with our friends, our family, and the people around us. So I would say just continue to check in on them, continue to ask those tough questions. But honestly, I will say this too. One of the learning curves of my job has especially been the fact that it is so much easier to talk to somebody about these things than you think that it is. Because most of the time people do want to talk about it. They just don't know who to talk about it with.
Yes.
So I think that that's definitely been something that every time I've either flat out or asked somebody, you know, a less indirect or less direct way, what their thought processes were, what's going on upstairs, you know, how are you doing? They're relieved that somebody's asking them.
You know, that's interesting you say that. So in my personal journey, I didn't talk about it at first. And then I started opening up to a few people here and there. Mm-hmm. And then I realized that some of my closest friends were dealing with these horrific things in their house that I had no idea about. And then the minute I opened my story up, I started learning about theirs. And I've gotten much less shy about talking about it, because I feel like every time I do, there's someone else that has a story to tell. And I think, and maybe that leads to the next part where I think kids, teens are very much more aware of their mental health and things. I know one of my kids' friends is doing a check-in now that they're remote, just because they don't see each other every day, you know, just making sure you're there, you know, which is kind of what you said is a good thing to do. But as adults, we don't, you know, first of all, we weren't educated in mental health. Yeah. And then how do you handle this? Obviously, it's something majority of us are dealing with on some level. So how do we promote more, you know, awareness and communication in the adult spectrum?
Well, I'm so glad you actually brought this up, because this is also something, I mean, I feel like I've learned so much in the past, you know, year and a half, I guess now. The highest rate for suicide is actually for middle-aged individuals. You know, there's a lot of different things going on in that age. You've got kids getting older, maybe parents getting older too. There are a lot of stressors going on. But I think that exactly what you're talking about, just about being open, you know, we're all human. We've all probably got that one thing we wish we could change or fix, and don't know how to navigate that all the time. And really, hopefully, too, as time goes on, we're doing such a good job with early education about suicide prevention. And so hopefully, as the years go on, what we'll end up seeing is a lower middle-aged rate, because we're teaching kids at a younger age. Especially because the FCC actually just passed the 988 phone number for the National Suicide Prevention Lifeline. I think it will become effective in 2022, but you know, I think about the first things I learned were stop, drop, and roll and 911. And so if we can add 988, a suicide prevention number, to that list of things that they're learning at a young age, that means they've always got that resource if they need it.
Yeah, that's awesome. I did hear about that. I didn't know when it was taking effect, though.
Yeah,
that's amazing.
I think it's 2022.
Yeah. Okay. Let me go to my next question. I was all into that.
Yeah.
Okay, is there, other than the hotlines and then the actual when you're in crisis, is there any other resources that parents can go to get more answers, more information?
Absolutely. There's actually a lot of different ways you can go with this. You know, looking at our website or American Foundation for Suicide Prevention's website, Jason Foundation, they also provide wonderful support for youth. All three of these websites have brochures by the thousands, probably, that you could pick out. Just talking about warning signs, talking about risk factors. You know, going back to education, I think that's really a huge part of things. Other resources, you know, that we do have a crisis text line, 741-741, if you text TN to it. I think that that's perfect too for people that maybe realize they're in crisis in a public place. Maybe they realize that they don't really want to say the S word out loud. And I think that's been a great resource. But just, you know, checking on people, making sure that people have the appropriate resources for what they need at the time.
Is there steps that you can take in your home that would, like if you know your child's suicidal, is there certain things you can do within your house to make it a more safe and kind of, environment?
Oh, absolutely. One of my favorite things to talk about during trainings actually is our firearms safety. We don't want to be anti-gun in any way, but the facts are that 2/3 of the deaths by suicide are our firearms. And that's heartbreaking because it's just such a lethal means. Really, that's one of those things where we can all do a little bit more. Just even making sure it's locked and stowed. Making sure that maybe we know that child, teenager, what have you, doesn't have the code. Maybe we're storing the ammunition and the firearm in separate places. Maybe while they're during a heightened period of crisis, take it out of the home altogether. Ask somebody else to hold on to it for you for a few weeks. Those are all really good ways to kind of keep that access to such a lethal means at bay. Another thing I will say too is just looking around at your home. If you notice that there are pills, lots of pills, if you notice that maybe there are just a few pills in a few different spots, and that's called stockpiling. And so what you're going to want to do is just, you don't have to be snoopy about it, but obviously somebody's life is far more important than that, right? So just asking the right questions. Once again, taking that access to that means away. I know that sometimes too, what we say is just give them enough for this period of time to where you know that it couldn't be used for something else. Or just to take them out of the public area of the house or somewhere that's accessible to everyone. Maybe putting them somewhere else, maybe stowing them just like you would a firearm, kind of.
So someone once told me in my process of speaking to everyone that, and this is a very common, I think, a common thought, especially when you get into the older population, that if someone wants to commit suicide, there's nothing we can do about it. There's not. So for people who that's their mindset, what would you say to that?
Well, I'd say there's been a lot of people that I've met that are still here because somebody did something about it. I think that it's important for us not to discount and discredit ourselves for the power and the impact we have on each other. And I do understand that line of thinking. I really do, and I try to understand it as much as I can. But I also think that on the flip side of things, well, if we can't prevent it, then who can? If we can't prevent our family members or our friends or the people that live next door to us or whomever, then who does that fall on?
Yeah. And I also noticed that you have I saw somewhere that you have a zero suicide initiative. Do you want to talk about what that is?
So we do. Right now we have, it's a little bit of an interim period. Our new executive director, Misty Leitch, she was the zero suicide director. So she will be she's promoted, and so we're gonna have to fill that vacancy. But it really is just working towards, working with the Tennessee Department of Mental Health and Substance Abuse Services towards having businesses and agencies that are committed to a zero suicide cause.
So how can we as a community bring awareness and support to our neighbors?
Yeah. That's a good question, because sometimes I think that that's also one of those things where we go, okay, so, maybe I took a training, but now how do I practice it? Maybe I got a little bit more of an education in this, but how do I bring that home? How do I bring it here? I would say one of the most effective things that you can do is just spread resources to people. I actually have a little, and my keys are over there, but a little Kroger key tag that has the hotlines on them. And I always pass them out to somebody. My selling line for it is, I'd rather you have this and never need it than need it and not have it. And then people usually grab like 10 of them at that point. Taking those just to mailboxes is something that'd be so easy to do for your neighbors. Making sure that, like we were talking about earlier, your kids have them for themselves and their peers. Right? I think just making sure that everybody kind of has a practiced and more narrow focused on how we're kind of going to bring that home, bring that to our neighborhoods, bring that to our communities.
All right. So is there anything that you talk about, you do your trainings on that I haven't covered so far?
So one thing that I do think is important, and I stress this in all of my trainings, I'm pretty sure all of our regional directors do, there are a few things that I think can directly change the trajectory here. Warning signs and risk factors. Whether you take a training with us or whether you just go and educate yourself, like I was bragging on Google earlier, it's so important that we do that. Familiarize yourselves with that. I think that's so important. And I also think that we need to understand too that sometimes people will say things, direct verbal clues is what we call them, or indirect ones, and we need to take these things that they say seriously. Sometimes people are being serious and sometimes they're joking, but they're wanting so desperately for somebody to ask them about it. And then that's why I said also earlier, hopefully it gives everyone some peace of mind knowing that most people do want to talk about it. Mm-hmm. And I think that that's something that always keeps us from asking. That what if they don't want to talk about it? And what if they say yes? Those are the two things that are so, then what do we do? And I think that that's the perfect time to kind of persuade them to help and then refer them to those resources.
One thing I found, and whether you're in a position like me with a parent with a child that's struggling, or, suicide is everywhere. You hear about a kid at school and it breaks your heart, but you don't know what to do.
Yeah.
I think that's the biggest thing. Key tags or whatever, but I feel like, especially as a parent, even if you don't know the child, hearing that person, committed suicide and wishing you could do so. You just feel so helpless and you wish there was something, but you don't know what to do.
Yeah.
Is there anything?
Yeah. I think that it's going to look different in every community. I think that we have, and that's actually one of the hardest parts of the job is postvention, and that's after somebody dies by suicide. We go to that business school, faith-based group, whatever it might be, and we debrief and we talk it over talk about the process of grief with kids too, because that's something they really haven't gone through before. That seat might be empty in their classroom, and that's heartbreaking for parents. It's also heartbreaking for them, So I honestly think that it's gonna change for every community. But one thing I will say is that offering that support during that time, and then also looking forward. What can we do to get ahead of this problem? Because that's something we've seen, or that I guess I'll say I've seen pretty regularly, is that we don't know how bad it's going to be until it happens, or we don't know what to do until it does happen. And so really the best thing we can do is have a safety plan, have some staff at that school or coaches or whomever, is with the kids regularly, have them go through appropriate training so they can keep watchful eyes on them. And also so that if a kid, child, young adult does express these feelings of suicidal ideation, or maybe it hasn't gotten that extreme yet, but they're struggling, then there's steps that we can take as a community, as a school, as a team, what have you, as a family, right? That can get ahead of the problem before it gets to the point where we're acting retroactively.
Yeah, that's a great point, because I know for us, and I didn't know I was doing this, but when with my child, having people at those locations and asking my child to confide in other adults, just have someone. So there was a teacher at school that she decided to confide in, that had and still does, the teacher has his eyes on her and making sure and checks in and is okay. But in other aspects too, in her extracurricular activities, you have a person. So it takes a village.
It does.
And it's not just like, your normal village that picks up car rides, but it's that too, right?
Yeah.
It's the mental health and well-being. So talk a little bit, I didn't touch on this at all in my questions, about, after suicide, after that happens, what are some, because that might be something some kids are struggling with too, and has to do with their own mental health, right?
Yeah.
Because they've witnessed that. What are some things that parents can help their kids with as far as that goes?
Grief was explained to me by a volunteer, and he actually had a wonderful whiteboard that he got to draw on to give this analogy, but I'll try to explain it as best as I can. So grief is kind of like a large ball in a square. After that happens, that ball doesn't really have a whole lot of places to go, right? It's taking up a lot of that space. As time goes on, that ball is going to get smaller. And it's going to bounce off those square walls the same way, but it still is going to ping against this little button every once in a while that's going to bring that grief back. You don't always know what that's going to be, what that trigger is going to be. But I think it's important for kids, adults, whomever, to understand that it is a grieving process, that it's okay also to not be okay. One thing that we do know is that a previous suicide attempt and also having somebody close to us that dies by suicide, both of those things increase our own risk for suicidal ideation. And I don't say that to scare anybody, but it's good to be educated about. It's good to know, because then we can go, you know what, this is affecting me a little bit more than I thought it was going to. And then hopefully, because we've debriefed or because that community has talked openly and honestly about it, hopefully moving forward, that's something that child, adult, staff, whomever can express and talk about. I just think there's nothing more therapeutic sometimes, at least for me personally, than talking about stuff out loud. And so it's kind of the same when we're looking at this.
For people, it is for me too. I think I think sometimes that tends to be a more female thing anyway.
Yeah.
But I mean, what if you're not a verbal person and you do kind of keep your feelings inside and don't let them come out for you? Is there other ways to grieve that would work?
I think, one I would say is if you're not really an extrovert at all, meditating sometimes that was great for my mental health during this time of COVID, to be honest. I also think just having your own routine, having that one thing, maybe trying a few different things, but having that one thing that you can go back to that's going to recenter you. Whether that's exercising, whether that's, it could be painting, it could be something like that, but just to have that ability to externalize in some way maybe what you're going through, I think would be advantageous. The only other thing that I have on here really is something that I didn't know before either, was that we just lose more people to suicide than we do, especially in that younger age group, to cancer and heart diseases combined.
Right.
I just had no idea before I was introduced to this line of work what the numbers were.
Yeah.
And it's okay to admit that, but now I just think, how did I not know? How did I not know our community reflected this number, this rate?
Well, and I think as parents, you try really hard to, you try to do everything you're supposed to do, right? You have dinners at the table, you have, you have them involved in extracurricular, you do help with the parties at school, you are an involved parent as much as you can be, and, and do a job or whatever. And obviously you always feel like you're lacking, but you feel like you're checking all these boxes. So when and the school, I know our school system does they do workshops on juuling and internet safety. Yeah. And then when I had my own experience with all this, and I started talking to people, I'm like, well, this is the biggest problem in the schools. It's not, they're juuling because they have anxiety and depression and things like that. So why are we not talking about it? And as a parent, there's no one telling you, there's not workshops. There's not anyone telling you take these steps so you don't have the kid that, that commits suicide, or you're in the position where you have to. If you're already doing preemptive work as a parent, then maybe you can avoid this. Yeah.
I completely agree with you. I'm glad that mental health is being talked about more. I really am, because I think that even in my lifetime, I've seen a huge change in that. But it's just the same thing that you were talking about, trying to get ahead of it instead of reacting, right? Because at that point, we've already lost somebody. At that point, a family has already been affected. The school's already been affected. And if we can get ahead of it, oh my gosh, and you do think about that too. It's interesting because we can talk about everything else, right, except for the dirty suicide word.
Right.
And I'll even actually, it's interesting too, as I've gone through this position, I either used to tell people during trainings, I'm going to see all of y'all's eyes bug out because I'm going to say suicide a lot during this next hour, hour and a half. And I know it's okay, but get comfortable with it, because that's why we're going through this training, is to get comfortable talking about it. And it's actually, the best is in my personal life, is when somebody asks me what I do and I say, oh, well, I do suicide prevention. And they're so taken back, and I'm like, well, it should be just as important as these other things, and I think it does take people going through personal experiences. I think it takes somebody like yourself talking about it, because really that's incredibly brave. I think that's amazing, because we need people to talk about it and to share their experiences, so that when others feel that, they don't feel so alone.
Well, and I think my age group, looking back now, I can go, oh, that person had, ADD, was maybe autistic, but there wasn't terms for that before. And not only that, but there wasn't mental health, and we weren't taught to talk about these things. We didn't. So I think as adults in my age group, we have to learn how to do that. So we don't, maybe suicide can be something that's, we can get the numbers down so it's not because we're so good at talking about it and making sure everyone's okay. And I think the kids coming up, they're much better. They're much more aware of each other, checking on each other. And you still have your typical issues with people being mean and bullies, and that's just,
That's just life.
It's just life sometimes. But, I think they are all very sensitive, for the most part, to kids who are struggling, or just recognizing that maybe they're not friends with them, but they know, well, that person's just having a hard time, and being understanding about that. So I think our age, the parents of my age group, really need to work at being as good as our kids are at that stuff.
I mean, sometimes it does take kind of hearing, because I will say I have a little cousin, and he said something the other day, and I thought, well, that's just so wholesome of you to say about somebody else, and it takes you back a second. But I honestly thought, oh, well, I'm going to learn a lot from him during Thanksgiving break, because they do have a complete different perspective about things, and it's really wonderful, and we just need to keep that forward momentum moving.
Mm-hmm, mm-hmm. Yeah. So hopefully, I'm hoping this will help. If it helps one person, we've done a good job.
That's what I always say. If of the 50 brochures I pass out, of the how many hundreds of people I've trained virtually over the last few months, if it reaches one person, that's one person that really needed some help and got the help that they needed that day. So
before we wrap up, do you want to give your website and the phone numbers that they can call again, just in case?
Yeah, absolutely. So our website is tspn.org. We have a place to request trainings, to sign up to volunteer, just to even look at our mission statements, look at the brochures if you'd like to order some as well to pass to your people in your community. And then the crisis line that we have, that's our statewide crisis line, is 855-CRISIS-1 or 855-274-7471.
Well, thank you very much. I appreciate your time and talking with me today.
Yeah, absolutely. Thank you so much.